We are now approximately 5 weeks out from a multi-stage procedure to try to assist with pain that was present in the inner foot arch and into the great toe that occurred after an injury when she hyperextended this toe as well as had an ankle sprain. So can you tell us a little bit about what your symptoms were like prior to surgery and what you first noticed after the first couple of days after this procedure?
Yes. Prior to the surgery, every day when I would wake up and I would put pressure right on this area, it felt like it was getting irritated, like a tens unit had been pressed to all the way up. The tip of the toe, I could feel touch to it, but I could not determine the difference between hot and cold sensation, and it also felt like my toenail was going to pop off all the time with the pressure.
And what happened when you would touch this area here? Was that sensitive or painful or numb, or what would you describe that?
I could feel it, but there was no, I couldn't feel temperature. I couldn't feel anything else except it was numb.
Okay. And after surgery, when you reached down and touched your foot a couple days after the operation, what did you notice? Did you notice improvement in sensation and pain and function? What did you notice?
The very first thing I noticed is my guy right here.
Your dog?
After you have surgery, they're concerned, and I had my foot elevated, and I could feel this big cold nose touching the tip of my toes.
So the first thing you noticed was you could feel the cold, wet nose touching your toe.
Absolutely, and I couldn't feel it.
And you couldn't feel it before surgery, huh?
It doesn't seem like a big deal, but when you have not had that feeling in over a year, and then all of a sudden you do, it's noticeable.
Very good. Now, how's the rest of the discomfort you had before surgery? These scars are still healing, by the way. They're early. It's only been about 5 weeks, so they're still a little pink and thick. These will get better over time for patients who are looking at this. These will fade away till you almost can't see them. This is just an area of thickened scar, which will all settle down here with time. And she has one up in her knee as well from a different procedure. Can you tell us what other symptoms have you noticed are improved with these procedures?
It doesn't hurt to stand on the tip of toe.
Mm-hmm.
I can feel walking down here now, whereas I think before, when the nerve got irritated, I probably was just spasmed the whole time.
Mm-hmm.
So I was walking more on this part of my foot, and I guess that's how it affected everything else, but I can feel like this is fine to walk on. It doesn't feel like that sword is sticking in there anymore.
Okay, so if you were to have to estimate what type of improvement you've seen so far, knowing you might continue to see improvements in the future, what level of improvement? It was only 5 weeks out from surgery, so what level of improvement do you think you have now compared to where you started?
I say 7 or 8.
7 to 80%, or
Yes.
7 to 80%? Okay.
Yeah.
Would you consider that reasonably good improvement?
Yes.
Okay.
Yes.
Very good.
I can go back to work again.
All right. Fantastic. Thank you very much.
Mm-hmm.